How to know if you have a cold, flu, COVID-19, or something else. Everyone seems to get ill in January, and there is always something going around. This is the time of year where there is a rise in seasonal viruses, infection rates for flu increases, and even COVID is still lurking around. And now it seems that norovirus is also trending this winter. So how can you tell what you have? And what can you do about it? How to know if you have a cold, flu, COVID-19, or something else. Scientists think that the winter surge of flu and cold may be a result of us spending more time indoors. The cold, dry air may also weaken our natural defenses, leaving us more susceptible to getting a cold or flu. So while it may feel almost impossible to go this season without a slight sniffle, it's always worth knowing what you have. What are the symptoms for the common cold? One of the most common symptoms for the cold is a sore throat. However, some people also report having aches and pains, as well as general fatigue. You may also have a runny nose, congestion, cough, sneezing, headaches, and it tends to last for less than a week. But if you have a fever and find it difficult to breathe, then you may have something else. What are the symptoms of the flu? The defining symptom of the flu is a fever. You can also get aches, fatigue, and have a dry cough, as well as headaches, chills, and a runny nose. Flu symptoms tend to hit more quickly than cold symptoms, and can last anywhere from a few days to 2 weeks. Although sore throat is a symptom, having a loss of taste or smell as well as wheezing is not. That may mean there is something else wrong. What are the symptoms of COVID? One of the defining features of COVID is a loss of taste or smell. Much like the cold, you can also get a sore throat, and with COVID you may have difficulty breathing and have fatigue. You may also have a fever, chills, cough, congestion, aches, headache, nausea, or vomiting. And this can last for several days. What are the symptoms of RSV? Respiratory syncytial virus, RSV, is a common cause of coughs and colds, and most people tend to get cold-like symptoms that start within a few days of getting infected. The symptoms are a runny nose, congestion, coughing, sneezing, wheezing, fever, and a loss of appetite. This can last for a week or 2. What are the symptoms of the norovirus? Norovirus is a foodborne illness that can spread through water and contaminated surfaces. The symptoms are gruesome and can cause vomiting, diarrhea, nausea, and stomach pain. But this is short-lived and can last for about 1 to 3 days. How to ease the symptoms? It's often hard to tell which ailment you have since a lot of the symptoms overlap, but it is good to be aware of these symptoms even if you don't know exactly which bug you've picked up. Most of the treatments for these are to stay at home, stay hydrated, rest, and eat well. However, if your symptoms get worse or linger, arrange a visit with your healthcare provider who could help provide further treatment. How to protect yourself and others. Wash your hands. Seriously. Properly and with soap. This should be done especially after going to the bathroom, before preparing food, or before you eat. For extra precaution, wash your hands if you have sneezed into them, and after using any public transport. If you have norovirus, immediately clean surfaces that come in contact with contaminated food or bodily fluids. Try using household bleach to disinfect surfaces, but use with precaution, and do not mix with any other cleaners or disinfectants. How to protect yourself and others. With colds and flus, try and wipe down any surface that you come into a lot of contact with, such as doorknobs, light switches, countertops, toys, and cell phones. COVID spreads through the air generally, so the risk of getting the virus from a contaminated surface is low. Viruses can spread through talking, coughing, and sneezing, so cover your mouth with a tissue if you feel a tickle in your throat or your nose. Then, wash your hands and try not to touch your face. How to protect yourself and others. You could also consider a vaccine, as there are updated COVID COVID-19 vaccines available as well as annual flu shots. And for those 60 and older or for people who are pregnant, you may want to get the RSV vaccine. However, there is no vaccine for norovirus or the common cold. How to protect yourself and others. You could also consider a vaccine, as there are updated COVID-19 vaccines available as well as annual flu shots. And for those 60 and older or for people who are pregnant, you may want to get the RSV vaccine. However, there is no vaccine for norovirus or the common cold.